Well, from coast to coast, outrage over health care reform seems to be growing. This is what town hall meetings looked like over the weekend. Furious crowds showing up, venting their anger over the massive overhaul plans that are being debated. Town hall meetings are going on right now all over the country, and some of them needing to be beefed up with security guards. Others have been flat out canceled. Top Democrats are now blaming Republicans and other right-wing special interest groups for helping to stage the protests. Joining us today is Senator John Cornyn from Texas, who is also the chair of the National Republican Senatorial Committee. Nice to see you here, Senator. Thanks very much for joining us. What do you make of these charges that Republicans are behind some of the protests that are taking place?
Well, I remember just when President Bush was in office, Code Pink and MoveOn.org would stage pretty loud and boisterous demonstrations complaining about President Bush's policies in Iraq. I don't really see any substantive difference. It's the subject has changed, and I think these folks, by and large, are respectfully but loudly proclaiming their concern and expressing the rights that are protected by the First Amendment of the Constitution.
An opinion piece this morning in USA Today, the Speaker of the House co-writing an editorial saying that those people who show up at these meetings and try to drown out other views are in effect un-American. Those were her words. The people just speaking out are un-American for doing so. What do you think?
Well, I think that's really a pretty harsh statement about Americans who are concerned about losing the health insurance coverage they have now, seniors who are worried about drastic cuts, more than $500 billion in Medicare, which, as you know, is on a path to bankruptcy in 2017, and people are worried and they're expressing their concerns. My hope would be is they would be respectful and allow a discussion and not try to shout each other down. But, you know, I think people are worried, and that's why we're seeing this manifestation of that concern.
Jane just interviewed Linda Douglas from the White House staff and asked her about this idea of the White House inviting people to write them and email them information that they're getting that they think is wrong or fishy about the health care reform plan. You were on the record saying that you think that the White House is doing nothing less of compiling an enemies list.
Well, I think it's a dumb idea. First of all, I wish they had admitted that when I wrote a letter asking, what are you doing with this information? Why are you saving this information, asking people to turn in their neighbors and friends and others who may have questions or disagree with what the president is proposing here. But instead of that, they denied collecting names when, in fact, we know under the law they can't just dispose of that information willy-nilly. They have to retain it.
What did they say when you wrote them the letter?
Well, I'm still waiting on the answer to my letter. But this is really part of a pattern. Initially, when the health care proposals were rolled out, we know that various associations of stakeholders, physicians, hospitals, and others, the drug industry was basically intimidated into silence. And unfortunately, I think this is one of those areas where people can't afford to remain silent. They need to be heard because this is going to touch all 300 million of us here in the country.
When the president goes out and says, if you like your doctor, you can keep your doctor. If you like your health insurance plan, you can keep the health insurance plan that you have. Is he spreading misinformation? People don't seem to be believing it.
Well, I think they have a credibility problem because you have health care analysts that say 119 million people will lose their current health care coverage if a public option or government plan is embraced. And President Obama has said previously he supports a government-run single-payer system. So I think they have a credibility problem, and when people are realizing that what they are hearing in these wonderful, eloquent speeches is not consistent with the facts, then they are expressing their concern, and they have every right to do so.
One more question about health care real quickly. I know you were part of a town hall that took place over the weekend. What are your constituents telling you that they want to see with health care reform?
They're saying slow down. Take a good look at this. Make sure you read the bill before you vote on it. Things that are very common sense, but unfortunately in the crazy political environment in Washington seem are somewhat surreal. So they want us to make sure we get it right. We all agree we need insurance reform. We need to deal with the portability of coverage so you can take it from job to job. do away with pre-existing exclusions which prohibit you from getting covered if you do change jobs, and to bring down the cost by doing true insurance reform. We could agree probably on 80% of this that I think would really be a consensus solution. The problem is the overreach that is going to result, I'm afraid, in people ultimately ended up looking to the government for their health care.
It's amazing that things have gotten to where they are when there is so much agreement, some 70%, people agreeing on most all of these different things that are being debated. Senator John Cornyn of Texas, thank you so much, sir. Good to have you here.